Dr. Eli Tabari, and I'm an oral and maxillofacial surgeon. And here today I'm going to talk to you about a disease that could happen. I know we're all concentrating on COVID-19, but realize that diseases don't follow news reports or epidemiology reports. So actually this month in April is Oral Cancer Month, and that's what I want to talk to you a little bit about. And in this time, unfortunately, a lot of you might not have access to your oral surgeon or dental health care specialist or oral health care specialist. So what I want to show you guys today is that you could do some exams and analyze yourself and kind of be your own doctor. Okay, so what to do is you could go look in the mirror and make sure you have good lighting and look for anything unusual. Look, feel, and palpate any abnormal growths or lumps that you may have on your face and around your neck area. Now generally, if you do find something unusual lump, the general rule is the bigger that lump is, the worse the prognosis. And another general rule is that the less movable that lump is, the worse the prognosis is. Okay? So on your self-examination, you can look in the mirror and start right here in front of your ears in the preauricular region, then go down a little bit to the jaw area, your jawline, and check for any parotid lymph nodes, and then go right under your jawline and check for any submandibular nodes, and then come a little forward under your chin to look for any submental lymph nodes that may be inflamed. And then you could go back, and it's easier if you turn your head and locate this big muscle, which is your sternocleidomastoid muscle, and then palpate right behind the ear is your posterior auricular muscle, and then that bony area of your skull, which is the occipital muscle. Check for any nodes, and then you kind of palpate around the muscle. You could start on top, which would correlate to the superficial cervical muscle, and then go a little bit deeper and down more, which would correlate to the deep cervical lymph nodes, and then palpate more, and this will go to the posterior, more back. This would be your posterior cervical lymph nodes, and check for any lumps. And then you could actually go all the way down to the top of your clavicle region, and that would correlate to your supraclavicular lymph nodes. And this is where breast cancer, sometimes the lymph nodes from breast cancer spread. Okay, so that's the extraoral examination. Then again, you want to look in the mirror, make sure you have good lighting, and look inside your mouth. You could open wide, and then look at the back of your throat and inside of your mouth. Look for any unusual lumps, lesions, or ulcerations. Be sure to check the bottom of your tongue at the floor of the mouth, the sides of the tongue, so swing your tongue side to side and up and down. Now the important thing with oral cancer is, of course, the color of the lesion. And very generally, if you have a white patchy lesion that you see, it's rarely dangerous. Then if you see a bright red lesion, that is possibly dangerous. There's a higher risk of oral cancer for that. And then if you see a speckled red and white intermixed lesion, that is most likely dangerous. Now keep in mind, this is just, an overall exam. I don't want to scare anyone, but these are just things to look for, maybe to be on alert. Now also another thing with oral cancer is the locations of these colored lesions that I described. You want to look inside your mouth, maybe put your tongue up, and this graph shows the most prevalent areas where oral cancer occurs in the mouth. And as you can see, it's very prevalent in the floor of the mouth, and then going to the sides of the tongue, and then on the inside of the cheek, and then up into the back portion of the hard palate and the soft palate, as the picture shows. So I just wanted to send this out, make you a little bit aware to kind of self-examine yourself, be more healthy, be more alert and concerned, and to stay safe as much as possible. Okay, thank you very much.